Caroline Pereira's kids are happy and healthy now, but last month her 2-year-old daughter struggled to breathe. On professional advice, she rushed her to this Calgary ER.
Went to the front and they told me to get to the end of the line, which was out the door, and that when a nurse was available, they would come and check her out.
15 hours later, they finally saw a doctor. Hospitals across the country say they're short-staffed and overwhelmed. In Ontario, waits have hit record highs, over 20 hours last weekend in some hospitals. The president of Canada's Association for Emergency Room Physicians, Dr. Mike Howlett, says the situation is beyond critical.
There isn't time to debate and have discussions for months and years. We are in an incipient crisis mode.
Staff shortages, sick calls, burnout, backlogs, an aging population, and COVID have all helped expose widening gaps. During the pandemic, more families have been forced into ERs, with many general practitioners stopping in-person consults. Strain our healthcare system can't handle.
It's starting to try to recover, but it's not being particularly successful. And it is extraordinarily vulnerable to whatever is coming next.
A rising wave from Omicron's BA4 and 5 variants is pushing cases up again, but experts say they are also keeping an eye on another newer mutation, BA275. The World Health Organization has already warned about the subvariant, which was recently discovered in India and now in the U.S.
The concern with BA275 is the same concerns we had with BA5, which is how is it going to behave and how is it going to impact our society over the next few months.
And while this infectious disease physician says it's not cause for alarm, it should be a warning to prepare and make necessary changes to the system immediately. Pereira also wants to see action now.
I'm really terrified, truly, really terrified that we will need emergency services again.
Like so many families, worried her kids won't get timely care when they need it most. Jamie Mauracher, Global News, Toronto.